Hey there HHD students, my name's Andy, I'm a VCE Health and Human Development teacher. In this short video we're going to look at answering the 2018 VCE HHD exam, question number 4. Before we jump into that, don't forget the Health Resources Hub YouTube channel's got a new video like this one coming out each day between now and the HHD exam at the end of the year. So if you subscribe, you'll get access to all of those, and please tell your HHD friends to do so too. I'm running the ACE HHD exam preparation sessions in September this year, and so you can book a spot to those if you like at book.acevce.com. You can see our social media links there if you'd like to follow us and get alerts to the new videos coming out each day, and also our email if you've got any questions or you've got any suggestions for videos you'd like me to work on. So looking at question 4 in the 2018 exam. Now this was the first year of the new study design and the first year that extended response questions between 8 and 10 marks had been introduced. And so you can see this is the first opportunity that students had to attempt one of these questions. And so it came up here at question number 4, and it started by asking students to consider 3 sources relating to the National Disability Insurance Scheme. So you can see the first source here was data from the NDIS quarterly report from September 2017. And so whenever looking at data and graphs, make sure you're trying to read everything on the graph just so you don't miss anything. So this was about the primary disability of active participants with an approved plan. So you can see that on the left, the primary disabilities were listed and then the number of participants with that primary disability. And by far away, you can see that intellectual disability and autism, were the most significant representation here of the number of participants with those primary disabilities with an active approved plan in the NDIS. Source number 2 was then data from a different quarterly report. And so once again, looking at the title, this was the percentage of NDIS participants that were reporting the NDIS was helping them in 2017. On the left, the percentage. Along the bottom here, on the x-axis, it's showing you the different activities that were reported on regarding whether or not the NDIS was helping individuals. So you can see there was daily living, relationships, social, community and civic participation, work, and then choice and control. And then in the key there, you can see they broke it down into different colors, and shadings for different age groups, which are then represented up in the bars in the graph. So there's quite a lot going on in this graph here. Whenever you get some data like this as well, make sure you run a critical eye over it too and think, well, is this a very good, representation of whether or not the NDIS was able to help people? And so you can see in some of those categories, for example, work, it's quite low down at 22 and 21% when looking at that 15 to 24 and 25 year and over group that mentioned that NDIS was actually helping them with their work. So not all of this data is necessarily that great. So that's just something to keep in mind as we move on to the next source and the question. So the following piece of information that was provided was some information about Anna and her son Daniel, who'd been recently diagnosed with autism, and so that meant he was eligible for assistance through the NDIS. They mentioned there was James, who was a local area coordinator, who met with Anna to talk about Daniel's needs and goals and develop an individual plan for Daniel. And James was also able to connect Anna with workshops for parents, which were designed to develop their knowledge of autism and ways to help their children build their skills and independence. And then part of the plan included funding for a backyard playground to help Daniel participate in activities to improve his imagination. So that was source number 3. Now, I've done a couple of videos earlier on regarding how you can approach the extended response questions in an exam. So part 1 is looking at the question and the sources, and then part 2 is structure and response. So I definitely advise you go back and watch those if you haven't, so you can really think about some of that advice that I give there regarding analyzing sources and the question. So you can see the question here for the exam in 2018 was asking you to use the information provided, analyze the NDIS's contribution to optimal health and well-being as a resource both individually and nationally. So you really need to break the question down. So it's obviously talking about using the information provided, and so you should be using all 3 sources. Analyze, and so you need to look at that keyword there. So when you're asked to analyze something, you've got to weigh up, positives and negatives. So is the NDIS making a contribution to optimal health and well-being as a resource both individually and nationally? And so I marked this exam a number of years ago, and the students that were able to achieve up in that high bracket of 7 to 8 marks, okay, were able to talk about some positives and negatives that were represented, okay, across all of these 3 sources. So what you need to make sure that you do in an answer like this, okay, is try to weave in the 3 sources and make connections between them. And so one example of that might be the fact that that first source mentioned that autism was one of those I guess primary disabilities, okay, with a large number of participants in the NDIS, and Daniel had been recently diagnosed with autism, so you could make a link between those sources there. You could also then talk about how the NDIS was perhaps able to provide assistance for Anna, Daniel's mother, and how that might have been acting as a resource for her individually, for her health and well-being. So it might have reduced her stress and increased her knowledge regarding autism and her, I guess, self-esteem, okay, and confidence in dealing with this new diagnosis of her son. So there's a link to how that might have assisted her individually. You could also make a link to how it could have assisted Daniel individually. So it might have improved his motor skills through funding that backyard playground, which would help him to develop his physical health and well-being. So there's quite a few links that could have been made there. But don't forget about optimal health and well-being as a resource nationally. So you could talk about, if you go back and look at source 2, okay, some of the information mentioned that NDIS was able to help quite a number of individuals with their social and civic participation and their relationships. And so you could mention how that might help to reduce absenteeism from the workforce if people feel like they've got high levels of social and spiritual health and well-being, if they feel like they've got a sense of connection, belonging to others. It might also reduce levels of conditions such as maybe anxiety and depression if they've got that connection to others, which might reduce the strain on the national healthcare system. So there were some opportunities definitely to make links there, both individually and nationally, regarding optimal health and well-being in these sources. But as I said, you should also critically evaluate. So you could talk about how if the NDIS had not really helped many individuals in terms of their work, well, that might decrease overall national economic activity, okay? And so therefore it might not have actually made an optimal contribution, okay, nationally in that aspect. So there was opportunities there to sort of weigh up both of those contributions, okay, of the NDIS to optimal health and wellbeing as a resource individually and nationally. So you can see the examiner's report here. It shows you that there were very few students, okay, that were able to score up, okay, in that high kind of 5 to 8 area, okay, and it gives you some information here about how responses are scored. So this is marked typically via a rubric approach, okay, at the end of the year, and so it's looking at things about how the response is structured, incorporating the stimulus material, okay, as well as obviously a discussion of how health and wellbeing is a resource individually and nationally. So you can go to the examiner's report and there's a sample answer in there for you to have a look at, and obviously if you've had an attempt at this question already, ask your teacher to have a look at your response, okay, to give you some feedback. Okay, hopefully you found that video useful. You're after more videos like this. As I mentioned, the Health Resources Hub YouTube channel's there. You can come along to the preparation session I'm doing for ACE at the end of the year. There's our social media links and also our email. Thanks so much.